Hey everybody, it's Andy Scott with Medic Coordinating Center here to make a quick video and let you know about the upcoming 2027 P4P and VBR measures for Medic. Okay, so we will start out with the P4P measures, and just as a quick reminder of how we come to these measures. So the annual pay for performance index starts out with the coordinating center, kind of looking at our data, coming up with some ideas and some benchmarks, run it through the Medic Executive Committee, and then finally get approval by Blue Cross Blue Shield, which we just recently got. Kind of the two big things that we look at are there any unintended consequences of choosing these targets, and do these targets represent a true and realistic improvement opportunity? So that's how we get to this point. So moving on to the actual index, this is just a reminder about the way that the points are distributed for sites. So sites that are in their first year, 100% of your points are on participation. Sites in their second year, 30% of your points move to performance, while 70 are still on participation. And finally, when you get to year 3 and beyond, 30% of your points are on participation and 70% are on performance. So let's look at the year 1 P4P. So these are sites that are actually actively joining now, so may not actually be watching this video till a little bit later, but this is how we distribute those 100 points. And it's basically points around data delivery, getting it on time and accurate, doing the data dictionary update, getting your abstraction done on time, coming to meetings, getting your abstractor hired, getting your data submitted, and then finally at the end of the year will be around year 2 intervention planning. So for year 2, this is again where you have 70% of your points on participation and 30% on performance. The participation segment is pretty similar to what it was in year 1, just the point values are lower. So again, get your data on time and accurate, do your data dictionary update, get your abstraction done on time, come to meetings, then do your stamp review at some point during that second year. What's new for a year 2 site is that now 30% of your points are on performance. So this year there will be 10 points on a site-specific measure. So you'll have to choose one of adult head injury, peds head injury, chest pain, or naloxone. You'll have 10 points on a collaborative wide chest X-ray measure, 5 points on a collaborative wide asthma bundle compliance, and then 5 points on PE diagnostic yield. Moving to our year 3 and beyond sites, again, now you have 70% on performance and only 30% on participation. Again, same performance activities, just fewer points as they go down to 30. And then on your performance, now you have to choose 2 site-specific measures out of 5. So you have adult head injury, peds head injury, chest pain, naloxone, or pediatric readiness. If you have been selected to do pediatric readiness, you've already been alerted, and you basically that's one of your 2, and then you just have to choose one from the other 4. If you either did peds readiness last year or you've not been notified, you're really choosing 2 out of the 4 between adult head injury, peds head injury, chest pain, and naloxone. Those are 20 points each. You'll have the same 3 collaborative wide measures: asthma bundle compliance, chest X-ray utilization, and PE diagnostic yield. Points again are a little different because you have more points on performance. So year 3 sites will have 15 points on asthma bundle compliance, 10 points on chest X-ray utilization, and 5 points on PE diagnostic yield. And again, you get to choose 2 of those. And if you're doing pediatric readiness, that choice has kind of already been made for you, and you've been made aware of that. For our PEDS only site, or sites if that should ever change, the participation points, again, unchanged. For your performance points, you'll have 20 on PEDS head injury, 20 on chest X-ray utilization. Then you'll have the collaborative wide measures for asthma bundle compliance and chest X-ray utilization. Okay, so now that we've talked about how the points are actually distributed between the different measures, now we will talk about the actual targets you need to meet. So for the site-specific targets, now remember you're choosing 1 or 2 depending on what your scenario you are in. For adult head injury, greater than or equal to 73% appropriate. For peds head injury, less than or equal to 14% utilization. Low-risk chest pain, greater than or equal to 95% discharge rate. Naloxone distribution rate, greater than or equal to 60% distribution. And then finally, for pediatric readiness, you need to score greater than or equal to 87 points on the NPRP survey. So those are your site-specific targets. And then for your collaborative-wide targets, for asthma bundle compliance, greater than or equal to 22% compliance. Again, this is everybody working together. For chest X-ray utilization, we need to be below 26% utilization. And then for PE diagnostic yield, we need to be at or equal to 8.0% diagnostic yield. So those are your site-specific and collaborative-wide targets for P4P. Okay, so new topic this year. This is something that's kind of been around the CQI world for a little bit, but is new to Medic, is that we are now going to offer bonus points for the first time. Bonus points can be earned on your P4P scorecard in either participation or performance. You can earn up to 5 points each. And the way bonus points work is that they can be used to replace lost points in other measures. So if you earn participation bonus points, you can use those points to replace participation points you lose. Say, for instance, you can't make it to a meeting, you can make up for it with some of these, or you can make up for performance points by doing better on one of the performance measures. You still can't get above 100. So this is just an opportunity to replace points that you lost in another one. So what do those bonus points actually look like for Medic? On the participation side, we've got two different ways you can earn bonus points. The first is to submit and display an academic poster at the October Medic Collaborative meeting coming up here in October. That's 2 points. We're pretty liberal on what those posters are. They just need to be emergency medicine related, not necessarily the things that we're working on. We should have an email coming out very shortly that'll give you the details on that. So we'd love to have your work presented at the meeting in Grand Rapids in October. And then for 3 points, when you could present quality improvement work at a Medic Collaborative meeting. So we will send out some feelers for people that are interested, but if you know you've got something you'd like to talk about, we would love to have you in the surveys that we do for our Collaborative meetings. Consistently, the highest ranked thing that we get is people hearing from other sites. So anything that you would like to present at a Medic Collaborative meeting, we'd love to have you. And that will be 3 participation bonus points. On the performance side, what we came up with is stretch targets, basically. So we're looking to do better, beyond the targets that we've got for regular points. And so we split those into 2 categories. Category 1 are, basically 2 measures that we felt like we really wanted to push on to kind of get some momentum around. So PE diagnostic yield, the stretch target is greater than 9%, or if you have a greater than or equal to 0.5% improvement from your previous year. Asthma bundle compliance, if you get over 50%, or a greater than 20% improvement, there's 2 bonus points available for that. So our other ones are category 2, basically, is worth 3 points. And that is if you get adult head injury over 85% or have a 10% improvement from the previous year, Peds head injury down below 10% or more than 5% improvement from last year, chest X-ray less than 10% and a 5% improvement from last year, and naloxone distribution, if you can get that up over 75% or a 15% improvement from last year, you can get 3 bonus points. So really try to present the opportunity to, if you're doing really well on one measure but struggling on another, maybe you can make up some of those points, or really just kind of a little bit of incentive to push everyone to try to get up and over the target as well as they can and really kind of push the collaborative's performance. We will talk about this in a lot of ways. I know the bonus points are new, but we're excited to give you guys the opportunity to earn these if it makes sense for you and your site. All right, so now that we're done with P4P, let's talk about VBR measures. So for VBR measures, the big thing to talk about is that the way that the scoring and that the percentage increase is distributed has changed a little bit. It's no longer 3%, 2%, 2%. It is still kind of 3 categories, but now you're going to get a chance to earn points like you do on P4P, up to 100 points. So the way that those points will translate into your actual VBR reimbursement is 0 to 39 points, no VBR, 40 to 51, you'll get 2%, 52 to 63, you'll get 3%, 64 to 75 will be 4%, and then 76 to 87 will be 5% VBR. And then finally, 88 up to 100 will be 7% VBR. So it's kind of a different way. The measures are pretty similar, but it's a different way of thinking about it. So you're looking to accumulate points in order to get these VBR percentages. So we've got it split into 3 kind of initiatives. So we're calling initiative 1 is our site-specific measures. So just like and the other thing we really try to do is make this as similar as possible to your P4P. So you're kind of only thinking about medic incentives in one way, and hopefully that'll make it a little easier for you. And then we made the choices and the targets the same too. So In Initiative 1, this is your site-specific measure. So each site will choose 2 out of the 5 in the table below. I'd assume most sites will choose the same 2 that you choose for P4P. And the way that this will translate into points is that if you hit the target on both of your selected measures, you'll earn 70 points. If you hit the target on only one of your selected measures, you'll hit 55. And if you miss both targets, you get 0. And these measures and targets are exactly the same as they were for P4P. So adult head injury greater than 73, peds head injury less than 14, chest pain greater than 95, naloxone greater than 60, and peds readiness greater than 87 on the survey. So again, really trying to mirror the P4P as much as possible to simplify the way that this is handled and communicated within your site. The second initiative, again, similar to the P4P, is our collaborative wide initiatives. So there's one caveat that we had to include in this it's kind of like a threshold or a gate that you've got to get through in order to be eligible for collaborative wide VBR. So to be eligible to earn these points, you have to have a 95% or greater on your low risk chest pain discharge at the end of the year. Almost everybody does. So hopefully this is a bar that's not too hard to cross, but it is something that in our kind of back and forth with Blue Cross, they wanted included here. So get collaborative wide VBR. First thing you got to do, hit your 95% on chest pain. And then we look at our 3 measures. So they're the same 3 collaborative wide measures with the same 3 targets that we used on P4P. PE diagnostic yield over 8, P's chest X-ray under 26, and asthma over 22. If the collaborative hits 2 out of the 3 measures, everyone that hit that chest pain eligibility target gets 15 points. If we get 0 or 1 of the measures, you get 0. So this is pretty similar to the way that we had our collaborative wide VBR in previous years, but it's a little bit different with the chest pain kind of entry point, and then the way that the points are distributed instead of the like percentages. Okay, so collaborative wide measures are 2, earn up to 15 points there. And then the final one, same one we've always done, is Initiative 3 is smoking cessation. Same thing we've done in the past. Last year we introduced that you could include asthma in addition to COPD. The targets have increased, unsurprisingly. So in order to hit this one, you have to have 1 month at greater than 35% performance or 3 individual months at greater than 20% hospital level performance. And so in order to do this, you just have to tell us, you got to start sending the data. There's no abstraction for this. So this is a fully automated VBR, no abstraction. You have to have it's got to come out of your EHR. So you need to set up a different or enhanced, I guess is a better word, data delivery from your site in order to be eligible for this. So you got to decide what patients you want, all qualifying patients or just admitted patients or just discharged patients. Then you got to tell us if you want asthma or COPD or both as your conditions. And the way this is set up, so this is worth 15 points. So basically you cannot get to the 7% VBR if you don't do smoking. If you choose not to do smoking, you're going to top out at 5% VBR, and that's the same as it's been basically ever since, well, not basically, that's the same as it's been ever since we started doing smoking as a VBR. Okay, so your next steps on P4P and VBR. So for P4P, all you need to do is select your site-specific measures on your intervention template. I will note that for bonus points, you don't have to make a choice. If you hit any of those targets, we will give you the bonus points. So you don't have to choose which one you're trying to hit. So just do well at everything, and maybe you'll get yourself some bonus points. So P4P, just pick your measures on your intervention template. VBR, same thing, select your site-specific measures on your intervention template. And I'll stress again that the measures and the targets are the same between P4P and VBR. We've heard that it was confusing before. Really tried very hard to align and make it as easy as possible to know what you're working on and communicate internally about that. So, but you don't have to pick the same thing for P4P and VBR. You could choose different things if you wanted to. So you got to select your site-specific measures. If you're doing smoking, you got to opt into it. Tell us how you're doing it. And then, as always with VBR, we really got to make sure that your physicians are enrolled in a Blue Cross, BCBSM, EGIP physician organization. That is complicated. We're happy to help. Not always super successful at helping, but if that's you can't get VBR if you're not in a PGIP PO. So you got to really make sure that you have got that under control. And then submit your intervention template by November 2nd of 2026. This is something that um, we've been doing for years. What's different this year is in previous years when our P4P and VBR were on different time cycles, you were emailing me your VBR selections. Now it's all in the intervention template. Everything's in one place. So pick your P4P, pick your VBR, and get to work on the quality improvement. So that is our 2027 P4P and VBR measures. Please let me know if you have questions. The whole team is ready to help you. Um, the goals on these measures were to keep increasing, progressing our progress, do better on all of our measures, but make it as simple to communicate and as simple to align your work as possible. So no questions too small. Please reach out and let us know if you have a question, and we will um, be happy to answer and help you get this done. So, all right, thanks.